We're going to continue the conversation on health, you and your health. And a lot of stories out there questioning drugs that are being prescribed these days and trying to discern the truth on them. Because, you know, there is something to be said that, you know, gosh, if you're in the media world, you know, nobody wants to go out there and say, hey, go ahead and take whatever you want. Everything's fine and you're just perfect, right? I mean, that doesn't leave. But on the other hand, if you're saying, hey, you take this and it could be a problem, then we all take we watch this kind of stuff. And I wanted to delve into one of the latest trends in medical stories that I've been talking about. It has to do with over-the-counter drugs and maybe causing dementia risks. And the person I'm bringing on here is Dr. Stephen Goldberg. He's the Chief Medical Officer of diagnostics giant, HealthTrackRx.com. Okay? And he's a physician, healthcare innovator. Doctor, it's a pleasure having you on. What family care, or family medicine and urgent care is what you've been doing for, 3 decades now, right?
Yep, 3 decades. Oh, my gosh. Bill, thank you. Good to be with you. Primary role is as Chief Medical Officer of HealthTrackRx, as you mentioned. But I'm a real doctor, and I practice regularly at U of L Health in Louisville, Kentucky.
Okay. Now, HealthTrack, it's a molecular diagnostic company here. So I noticed that there's all sorts of tests that people can just, sign up, and I guess you can get tested, and what is it about at a lower cost than like going through your hospital system or something like that? What's the purpose here?
Well, in general, patients access our testing when they go to an urgent care center or a family medicine office or a pediatrics office or a woman's health or internal medicine. They get our testing when they come in and say, I have an infectious disease complaint. Most of the time it's respiratory, but it could also be gastrointestinal, urinary tract, gynecologic, sexually transmitted disease, and other.
Yeah, and I also notice things that are kind of common, like, all right, hey, I think I have a urinary tract infection, right? That sort of thing, and then they would deal with you.
That's right. The way it would work is, let's say you're in an urgent care center, and you have a urinary tract infection complaint. You go in, the clinician comes in and reviews your history, does an interview, does a certain amount of exam. They might have some testing in their office. Let's say after all of that, they don't feel they've got a precise understanding of what's going on and a clear plan for treatment. That's where we come in. We have a single collection for any one of the infectious complaints I mentioned. It's picked up roughly at 4 anywhere in the continental United States, flown to our anchor lab in Louisville, and resulted out the next morning.
Wow. That's pretty fast service. Okay. Right. Yeah. So needless to say, though, you keep the FedEx planes going, right? Is that what I'm hearing? Essentially.
Yes, we're excited about our strategic partnership with UPS.
Oh, UPS. Okay. All right.
Yeah. And we're excited because we've had very rapid growth. Clinicians are finding great value in our testing. They want to give patients specific answers about what's going on. They want to be able to provide specific treatments, and that includes not using antibiotics when they're not necessary. I'm
also kind of curious. This is something I've always wondered. I've wanted to have a vitamin D blood serum test done sometime. And doing it in the regular hospital labs or something is very expensive, and insurance doesn't do that. Can you do that like outpatient? If I were to say, hey, I'd like to get a vitamin D test done, is that something you can do or not? I don't know.
Our company focuses on infectious disease testing with collections like I described. Others are in that type of business that you're describing. But frankly, talking with your clinician, they might decide to just replace your vitamin D with an oral medication for a certain interval of time rather than draw a lab test first. So that's something I'd have you talk with your doc about. Okay, yeah. Well, my clinician, though, or my doctor is an imaginary friend. I think I can see him every 2 or 3 years. I think that's the way that goes. Come to Louisville and we'll take care of you. All right, I appreciate that, Doctor. Dr. Stephen Goldberg. All right, enough about my problem. It's not a problem. I was just always kind of curious now that I'm talking to a doctor with a big lab.
at his disposal. The stories that I've been reading much of, and this is what you're keying off this morning, is a big rise in concerns about possible dementia risks of over-the-counter drugs. And I've been reading stories like this in Epic Times and other news outlets all around the country over the last few months. Is this kind of a new concern or just something that they're finally starting to take a look at? I was wondering if you could set the table for us, Doctor.
Yeah, glad to set the table. You're absolutely right. There's ongoing discussion because of the increasing observation about Alzheimer's disease and how devastating it can be for individuals and families to understand everything we can about risk factors and triggers. So there's lots of discussion about common use medications and whether they are associated with a pathway to Alzheimer's. By common, I mean things like diphenhydramine, which is Benadryl, oxybutynin, which people might use for bladder issues, ditropan, and also some mood-related medications, amitriptyline like Elavil. So those are common medications that are being questioned, common medications that are being studied. And
what kind of evidence have you seen at this point that that there may be, like we're seeing something indicating that you're taking this particular medication, you're taking Benadryl, and then all of a sudden you get a higher risk of dementia, or is it something that we are observing with long-term use? Any thoughts on that?
Yeah, the recent paper that I think many are talking about, which came out in the American Journal of Epidemiology in March, looked at this question. So let's talk about that paper. It's a paper that looked at a very big database in the United Kingdom that has millions of patient records, from which over 2,500 studies have come out. And so they wanted to ask the question, when you're treating someone, for example, with hypertension, and that hypertension medicine might be associated with some side effects that people are concerned about, quote, anticholinergic side effects, close quote, what happens to people long term, right? Do they get the benefit of the hypertension, or do they get the harm for the anticholinergic effect? So they looked at a large database, and what they found is in short term, there really was not an impact. And in fact, at long term, folks that were taking this particular type of blood pressure medicine that did have some mild anticholinergic effects, overall had a lower incidence of vascular dementia, about a third.
They had a lower level of dementia?
Yeah, correct.
Oh.
Vascular dementia. Right?
Okay.
So the message from this one large database analysis was that, hey, we often hear concerns about anticholinergic medicines, right MAIS dementia, but it's not black and white. And in fact, some older, well-established blood pressure medicines, which have some mild anticholinergic effect, might actually help prevent you from getting dementia if used over many years. So
that's really interesting. Now, an anticholinergic, I'm not a medical professional here, so I'm going to have to you're going to have to speak slowly to me here, doctor. All right, would that be a judge? Okay, I'll give you an example. I'm on one prescription medicine, and it's for a little bit of not AFib, but a pre-beat something or other that the doctor gave me a number of years ago. I have a tiny dose of metoprolol. Is that an example of that kind of anticholinergic kind of medication? It's a very old blood pressure medication, as you know, right?
Yeah. I mean, metoprolol is a blood pressure medicine. You're absolutely right. And it can have some mild anticholinergic effects. That's true.
All right. And so
here's what here's what I would say, that when we're talking about anticholinergic effect, to just make it in common terms, your brain has lots of neurons. The neurons are connected by synapse points, and at those points, there's chemical reactions. So what we're really talking about is of all the things we might take to lower health risk, to make us more comfortable, do those things have an impact at that connection point? And what's the consequence of that impact over time?
Mm-hmm.
And so the point is that some medications can be harmful at that point, and then others, the benefits might outweigh the risk, if you will.
Okay, all right. Now, is this what they call? In one story I read, they termed it interrupters. You know, that a lot of the drugs that we're taking these days for heart, blood pressure, asthma, whatever it is, sometimes even trying to sleep better, are interrupters of some sort. Is this the effect that you're kind of referencing then, like they're interrupting a function of the brain or getting in the middle of it, whether it's making your heart beat more slowly or whether it's making something else happen in your body? And the concern is that long-term use could be driving more Americans into dementia. That was the concern I was reading. Is that what are we talking on the same page here, Doctor?
We are talking on the same page.
Okay.
We are talking on the same page. And medicines that will continue to be studied for the benefits versus the risk will include things like opiates,
mm-hmm.
benzodiazepines, antihypertensive medications, and others. Yes.
Valium, Xanax, all those kind of things too, right? A lot of brain drugs.
Yeah, and well, those are in the benzodiazepine case, and those can increase dementia risk over time, modestly over time. The benzodiazepine category, but again, you got to take that individual patient, and the question is, why are they taking that medicine in the first place? And it's a benefit risk consideration.
Okay, yeah. Because if you have severe hypertension, high blood pressure, that's really, really bad. It can cause some severe damage. And, maybe instead of blowing your kidneys out and everything else, you'll take the risk and do a blood pressure medication and then help that out. It's a balancing act is what you're telling us then, right now.
It is a balancing out act, and that's exactly what I'm saying. And so if you say to me, Dr. Goldberg, what is the news my listeners can use from this recent study?
Please.
The news is that treating your hypertension is important to lower your Alzheimer's risk. Yes, it might be associated with a category of action in your brain that might have a problem, but on balance, in a large study, getting your hypertensive treatment was more important.
Okay. So once again, benefit versus risk. There's always some risk. Then we're still looking at, in many cases, some of these serious serious diseases better. What about long-term use of maybe asthma medications over the counter that people often get? Sleeping pills that are available over the counter too. One that comes to mind, what is it, doxylene succinate or something like that? That has been accused of having some of these problems too. Is there any evidence that the over-the-counters are any better and or worse that there needs to be some concern over?
Well, you mentioned a few different types of medication. I would say there's increasing concern with over-the-counter medications and lots of recent discussing about diphenhydramine and Benadryl.
Mm-hmm.
And let's continue to watch those conversations. I would say, in general, people that are using benzodiazepines and opiates really need to make sure they've got a pressing need for using those category of medications and have not been able to be on something else, because as categories, over time, using those medications is associated with some increased dementia risk.
Doctor, what about the antidepressant type of drugs? Is there any particular concern on that? A lot of America seems to be on one form of an antidepressant drug or not, and I don't know if these have those kind of effects like you were talking about earlier or not. Do they?
Well, we did talk about an older style blood pressure medication, amitriptyline.
Mm-hmm.
Elavil is the brand name. And those medications are associated with a disruption of flow, if you will, at that synapse in the brain.
Yes.
And so there's some concern that over time, extended treatment could be associated with Alzheimer's disease risk. But again, you have to balance how people can function and what the options are for them in getting their depression treated. Getting your depression treated is critical for long-term health. So again, it's a balance.
Okay. I know that, and I have a feeling the reason why people are looking into these studies here, and I mean, you as a medical doctor would probably understand, you can't help but notice a huge change or a huge increase in the pushing and the building of memory care centers in the United States. And it's probably not all just because of the demographic boomer shift, is it? You know, there seems to be a trend. And is there any meat to that trend in your medical opinion?
Yes, I think there is a link to that trend that has to do with people's overall health. And by health, I mean body weight versus target, presence of prediabetes and diabetes versus where you'd want to be optimally, a nutritious diet, the absence of smoking, the presence of really good sleep. A really good thought leader in this whole topic is Dr. Eric Topol, who recently wrote a book, Super Agers, an evidence-based approach to longevity. And his overall message is that of all considerations, genetics versus lifestyle, living a good lifestyle is the major factor about how you're going to age, more so than your genetics. So a lot about healthy living is linked to reduced incidence of Alzheimer's disease. There are some blood tests and other things that you can help understand where you risks are a little bit better. But again, what I want to encourage your listeners to say is that getting sleep, eating a balanced diet, getting your blood pressure controlled, making sure you don't have diabetes, are all things that can, in aggregate, make it more likely you'll live older and be healthy.
Yeah. You know, doctor, the sleep is the big one for me. That is the tough one. I don't think I naturally want to get up at 3:30 in the morning to come to work. What about you?
Yeah, fortunately, I don't have to do that. But I frankly do use a particular device that monitors my sleep. And I interact with it to see how I do each night. And I make some adjustments on activity and food to do better on those metrics because of how much I know and increasingly appreciate the importance of a good night's sleep.
What do you do? You said you have a device. What is that? Do you mind? You share?
Well, yeah. Well, I'm not formally associated with the companies, but I have both an Apple Watch and I have something called an Oura Ring, but there are multiple other devices. And I use data from both to help inform my sleep patterns. Yeah.
Oh, okay. Doctor, I appreciate you coming on this morning. I know you have other people to talk about, and I could keep going for a long time, but I'm going to direct people to your website, though, which is HealthTrackRx.com. I appreciate the take, and would the final takeaway be, though, that if you can possibly wean yourself off of a lot of those over-the-counters, using them all the time, would that be a good thing to do if you can find a way to do it without it, go without some of those medications?
Bill, I respectfully, I wouldn't go there. I would say, first of all, what does this study tell us? Mm-hmm. The study tells us that getting your blood pressure controlled is important to lower your long-term risk of Alzheimer's disease. That's what this new study says.
Okay.
The study also says that some of the side effects that we're concerned about can be outweighed by good blood pressure control. Now, to your point, if you're on any medication that there might be an alternative to, talk about it with your doctor, and particularly categories of medications such as opiates and benzodiazepines.
Now, benzodiazepine, is that Benadryl, what you're talking about?
No, that would be something like Valium would be in that class of medication.
Okay.
You might need to be on that medication, but if there are alternatives, that you should discuss those with your clinician.
Doctor,
Okay. Yeah. Offering just general.
Yeah, we're not giving medical advice, just a general overall view, the 50,000-foot medical view, right? That's what we're talking about here.
Yes, sir.
All right. Dr. Stephen Goldberg, once again, Chief Medical Officer of diagnostics giant HealthTrackRx.com. I appreciate the take on that. Thanks so much for delving into that study a little bit. You be well.
Take care.